Kinship care is when a child isn't able to stay at home with mum or dad and they're placed with a family member or a friend. Over the past year, we've been conducting research in the area of kinship care. This research has actually been the largest pool of carers and clients that we've looked at. So some of the findings from the research were that acknowledging that the majority of children who are in out-of-home care are in kinship care. So we're talking about 20,000 children in the state of Victoria in some form of kinship care. What we identified is that the majority of kinship carers are actually grandparents. So we're looking at about 63% kinship carers. That they are struggling. Some of them have even had to return to work or look at a second mortgage for the home to be able to look after that child. A lot of those carers are not receiving support from an agency or from the government because they're either flying under the radar and not realising they can access supports, or else they're, I suppose, long-term carers that haven't realised that the support is out there from agencies like us. What we've also found for the children was that the majority of the children are struggling educationally. So by Baptcare prioritising this area of research has really shown to our staff and our families that Baptcare is invested in effecting change for our kinship carers and our children. Historically, the focus in this area for out-of-home care has been on foster care or on residential care. This is really the first time that there's been an agency taking the lead to look at the needs of our kinship carers and our kinship kids.